Hi everyone, my name's Emma Guymer. I'm a rheumatologist in Melbourne. And because things are so different and we are living our lives so differently, I think it's really important to keep our self-management routines going. I think it's easy to get out of the pattern of doing what you usually do to maintain your health, and routine is very important. It keeps our general management going, and it keeps us well and healthy, um, and avoiding any worsening of symptoms. But it's also um, quite good to keep those sort of self-management routines going as a way of maintaining a little bit of normality for us all. It's very important to maintain regular exercise components of our self-management. We all should be doing a little bit of something every day, even if we're largely confined to the home, and there's different ways that we can be creative about it. But it also helps manage stress levels. If you keep your self-management routine going and you still do your 30 minutes of walking or your relaxation meditation activities at the same time each day, it helps with your sleep patterns, it helps with generally feeling well, and it helps you feel like you've got to the end of the day and have still accomplished your management routine, so you don't feel like everything's sort of spiraling out of control. It is really important to recognise that stress levels for all of us are likely to have increased. I mean, we're worried about, COVID in general and its general effects on our community. We're worried about catching it ourselves and being unwell and what that might mean. We're worried about what's happening with our work and financial situation. And we're not able to get to our usual activities and see our friends and family and things. So all of those things add to the stress. That's why having a regular routine is really important. A couple of things. I mean, the main thing I'm being asked about as a rheumatologist in this situation is about stopping immunosuppression therapy. And I understand why that seems to be an intuitive response, given that we're all worried about catching an infection. But I need everyone to realise that we don't have any evidence that there's increased risk of respiratory or life-threatening complications if you do catch coronavirus while you're immunosuppressed, and we know that from data coming out of Italy and elsewhere. Also, if you stop your medicine, you're putting yourself at increased risk of flaring your autoimmune disease, and you might end up with worse illness, needing more immunosuppression or steroids or even a hospital admission. And that's obviously something that we want to avoid too. So keeping well and healthy and keeping your disease under good control is the most important situation. And also, clearly, if you're on corticosteroids, then they can't be stopped suddenly without potentially serious complications. So make sure you're taking increased precautions, as we all are, and obviously, if you're concerned that you've had contact, then you speak to your rheumatologist about perhaps delaying your dose of your immunosuppressive or biologic medication. And if you get unwell, you need to go along and see your GP, obviously, but phone them first to let them know you're on your way. I think it's important to educate yourself a little more, and obviously the Musculoskeletal Australia website is a good place to go. Rheumatology.org.au, which is our Australian Rheumatology Association website, has some coronavirus advice on their homepage. You can click on that link. There's also Arthritis Australia, Creaky Joints Australia, lots of other places that you can get some good advice about things. I think a couple of other things that I think are useful. If you can't get out and about to do your usual exercise, clearly the pools are closed, you can't get to hydrotherapy or water exercise, or the gyms, going out to walk may not be an option if the weather gets colder and things. Remember to be a little creative. I think that YouTube is a great resource, and if you can sit yourself in front of YouTube on your computer or your TV and do some chair yoga, there's quite a few YouTube videos with some chair yoga, which is great for if you've got widespread pain or arthritis, and it's a really great resource to do some yoga there, or some Tai Chi through YouTube. And I think they're great options to do in your lounge room if the weather's cold and you can't get out to your regular exercise. And the last thing I'd like to say is make sure you're kind. Make sure you're kind to yourself. Make sure you're kind to other people. We're all under stress, and I know it sounds a bit trite, but honestly, cut yourself some slack, and everybody's worried, and we're all supporting each other as best we can. And I think that's probably the best way we can approach all of this. So stay well, stay happy and healthy, and we will get through it. All right, take care. Bye-bye.